As a parent, it can be really worrying when your child has a high temperature. The good news is that it's really common, easy to manage, and in most cases clears by itself without any treatment. However, in some cases, a fever can be a sign of a more serious problem that requires immediate medical attention. In this episode, we'll cover how to spot a fever, how to manage it, and when to ask for help. Hi, I'm Dr. Sinan, the GP, source on all things health related for you and your family. A fever is a high temperature. As a general rule, in kids, a temperature over 37.5 degrees is a fever. If your child has a fever, they might feel hotter than usual when you touch their back or chest, feel sweaty, have flushed cheeks, or look or feel unwell. So how do you check a child's temperature? The quick and easy way to find out whether your child has a fever is to take their temperature using a non-contact or digital thermometer. You can buy these from pharmacies or supermarkets. If your child is under 4 weeks of age, an electronic thermometer in the armpit is probably the most accurate and practical option, whereas beyond 4 weeks, most options are fine and generally better than just touching their forehead. Be aware though, if your child has just had a bath or been wrapped tightly in a blanket, their temperature may be higher for a little while. Wait a few minutes, then try again. Although it's really useful to know a child's temperature, it isn't a perfect proxy for how well or sick your child is. We need to take into account other factors such as their age, how they're acting, how long have they had the fever, and are they drinking fluid, and if they have any other symptoms. Let's move on and talk briefly about the science of how the body produces a high temperature. Bear with me here. Most fevers are caused by infections. At our usual body temperature, infections tend to multiply more and get worse. To prevent infections from multiplying and making us really ill, our body raises its temperature in order to fight the infection. It's a normal and healthy part of our immune system. When we have an infection, our brain tells our immune system, the part of our body that helps to fight infections, to raise the temperature to a new, higher temperature. The body does this by preventing heat loss, such as sweating less and making our blood vessels narrower. That's why we look pale sometimes, as well as warming up, such as sleeping under more blankets and using a hot water bottle. During this early part of the fever response, we are often warm to the touch but feel cold and shivery on the inside. Kids don't often like to be cooled down during this part as they're already feeling very, very cold. Once your body reaches the new higher temperature, this feeling of coldness stops. The brain then tells the immune system to reverse the temperature and go back to its normal level. The body does this by losing all of its extra heat, which is when we feel really sweaty and really flushed. This process generally lasts the first 24 to 48 hours of an infection, but can be longer in some cases. So what are the common infections that cause a fever in kids? Well, the most common ones we see in general practice are infections in the throat region. We call them upper respiratory tract infections, such as tonsillitis and pharyngitis, your common throat infection, ear infections, urine infections, and things like chickenpox. You may also notice your child having a temperature for a short period or time after a vaccination, and for young babies, the temperature can mildly increase with teething too, usually by about half a degree. So how do you manage a fever in a child? Most fevers in kids and babies can be managed at home. However, it's really important that you seek medical help if you have any concerns or if you're really worried about them. Here are some tips and tricks you can do for your child to keep them as well as possible when they're feeling poorly. Keep your child at home, especially in the early stages of an infection when they have a fever. It's really important for them to rest, which allows their body to help fight off the infection. If they're hot, try to keep them at a comfortable temperature and appropriately dressed for the surroundings. It's fine to just cover them with a lightweight sheet and to crack the window if it helps. Give them plenty of fluids. Little and often is the mantra here. Too much too soon often makes kids sick, which puts them off taking more fluids. For babies, stick with breast milk or formula. For toddlers, stick with cool water. Parents often tell me how difficult it is to get their child to take fluids when they're ill, and understandably so. It's so tricky when your child is irritable and they're fighting you. It's almost a battle sometimes to get them to take the bottle or sippy cup or even latch onto the breast. One trick I often use with my own kids is using a syringe if they can't take it from a cup or bottle. Giving fluids is also really important. If you don't, and on top of this they're unwell and hot, they can become dehydrated quickly, which can make them feel more unwell and ill. For children who are out of nappies, the signs of dehydration are dark urine or producing a small trickle of urine, having dry mouth and lips and feeling dizzy and lethargic. For babies who are in nappies, a good way to check if your baby is getting enough fluid is to count how many wet nappies you change in a 24-hour period. If on a normal good day you change your baby's wet nappies about 8 times, but during their illness you've changed it less than 50% of normal, say less than 4 times, that would be a cause for concern, meaning your baby is not getting enough fluids in them and is at risk of becoming dehydrated. You must seek medical attention should this happen, or if you have any concerns at any point with your child's illness. I often hear parents also say their child is not eating much when they're unwell. That's okay. We're not too concerned about what they're eating, more so the fluids, as we've already discussed. Kids usually catch up on their eating once they're feeling better. You can always try some soft, simple foods for your kids, but don't force it if they really don't want it. During the night, try to check in on your child regularly. I usually say about 3 hourly. The medical evidence also suggests giving paracetamol if your child is unwell or distressed. On that note, paracetamol is your friend and it performs a double whammy as both a painkiller and an antipyretic, i.e. a medication that decreases fever. This is great for taking the edge off that sore throat and may even give kids that little bit of extra confidence to drink or eat more, as well as cooling them down. I tend to advise parents to try paracetamol rather than ibuprofen first, as it has fewer side effects, and if it doesn't work, then you can try ibuprofen. If neither work, then try alternating both together, but only use both if necessary. Make sure you check the label to give the right dose and frequency, and continue only for as long as your child appears distressed. As a general rule, paracetamol can be given 4 times a day and ibuprofen 3 times a day. Over a 24-hour period, you can usually give one of each medications every 3 hours. So for example, 9 AM paracetamol, 12 PM ibuprofen, 3 PM paracetamol, and so on. There's a link at the bottom of the page on how to give medications to kids with an oral syringe if you're not quite sure how to do it. A few things that you may want to avoid are undressing them fully or sponging them down or using a fan to cool them. These measures can affect normal heat loss and can sometimes make the child worse. Don't cover them up in too many clothes or bedding, and don't give paracetamol to kids under 2 months of age or ibuprofen to kids under 3 months or those who are asthmatic. Avoid giving aspirin too, especially to kids under 16 years of age. There are a rare syndrome called Ray's syndrome, which is a very rare brain disease that is precipitated in kids who take aspirin. As a parent, you know your intuition. Trust it. If you're worried, get medical advice. If you've tried all of the above measures and you're not too worried, at what point should you be contacting your GP team or 111? Sometimes when a child has a fever and it's not settling, it can be difficult to know whether you and your child need some help from a medical professional. You should call 111 or your GP team if your child is under 3 months of age and has a temperature of over 38 degrees centigrade, or you think they have a temperature but can't check. Fevers in babies less than 3 months is unusual and you should get it checked out. If your child is slightly older, 3 to 6 months of age, and has a temperature of 39 degrees, slightly higher, or you think that they have a temperature and you can't check, they should get checked out too. Remember, fever is caused by the brain telling the immune system to raise its temperature. Before 6 months of age, the immune system is immature, so the response may be muted. This is why the younger the child, the higher the chance that a fever is likely to indicate something serious. After the age of 6 months, kids tend to have higher fevers than adults, but this does not correlate well with severity of disease. What I mean is that a high fever as a child gets a bit older does not necessarily mean a worse disease. Consider calling for help too if your child has other signs of illness, such as a rash and a high temperature. This is to usually clarify the source of the infection and exclude other worrying causes. If your child has a temperature for more than 5 days, get it checked. Most fevers should disappear within 2 or 3 days, so there may be another reason if the fever continues to persist. Get it checked also if a temperature does not come down with paracetamol or ibuprofen, or if your child is dehydrated or has an unexplained fever within 6 months of travelling from a country where malaria is common, or if you're noticing that they're not their usual self and you're worried. Again, use your parents' intuition. If you're worried, get medical advice. So at what point should you be calling 999? This would be the case for life-threatening circumstances. If your child has a stiff neck, if your child has a rash that does not fade when you press a glass against it, fever with spots or rashes that do not fade under pressure is a medical emergency, and it could be a sign of meningitis. See the link below for how to do this glass test. If your child is bothered by light, has a fit for the first time with a seizure, is unusually cold hands and feet, or is blue, pale with blotchy skin, lips, or blue tongue, these are all signs of a poor blood supply. Then you should call 999. If they have a weak or high-pitched cry, not like their normal cry, or they're drowsy and hard to wake, or extremely agitated or confused, do call 999. If they find it difficult to breathe and sucking in their stomach under their ribs to breathe, do call 999. All of these are signs of meningitis and sepsis, which is a widespread infection in the blood. We spent most of the time in this video outlining the worst case scenarios for a child with fever. In the vast majority of cases, fever is due to a non-serious viral infection that the body manages without antibiotics that usually lasts for a couple of days, sometimes with other symptoms. Today's take-home messages are: fever is the commonest reason that we see a child in clinic. They are almost always caused by an infection and are usually associated with other symptoms such as cough, runny nose, or a rash. Fevers can be managed at home by keeping children comfortable, prioritizing fluids, and using paracetamol if needed. Some fevers need medical attention, especially if there are signs of meningitis or infection in the blood, or if babies are affected. Trust your parental gut. If in doubt, reach out for help. If you found today's topic useful, don't forget to share with your friends and family and click the subscribe button to stay in the loop. You can find out more at drsinanthegp.com. If you have any questions or comments or suggestions for future topics, I'd love to hear from you, so do message in the comments below. Thank you so much for watching. Till next time, stay healthy.